C-reactive protein. Overview. C-reactive protein will be discussed under the following headings: Introduction, Values of CRP, CRP versus ESR, CRP in COVID-19, Advantages of CRP, and High Sensitivity CRP. Introduction. CRP is an acute phase reactant that is used as a non-specific screening test for infectious and inflammatory diseases. It is produced rapidly by the hepatocytes in response to inflammatory cytokines, including IL-6. CRP has a biological role in clearing pathogenic microbes, nucleic acids, and other substances from the circulation, and it can activate complement. CRP values. Normal CRP. The normal value of CRP is less than 8 mg per liter, but it varies between different labs. CRP values are higher in women and they increase with age. A bedside formula can be used to estimate the upper limit adjusted by age and gender. As per this formula, the upper limit of normal CRP value in males is age divided by 5, and in females it is age plus 30 divided by 5. Elevated CRP. CRP rises with any acute or chronic inflammation, infection, and tissue damage. It is also elevated during second half of pregnancy with oral contraceptive use and in some malignant diseases. It is less reliable marker of inflammation in SLE patients where presence of very high values of CRP, for example greater than 100 mg per liter, suggests presence of infection rather than active SLE. CRP versus ESR. Both CRP and ESR are markers of inflammation and infection. However, there are two important differences. Levels of CRP tend to correlate with the ESR but respond more rapidly to changes in patient status. So, the CRP rises rapidly within 4 to 6 hours of the onset of inflammation or tissue injury, when ESR is often normal. Similarly, it declines relatively rapidly with resolution while ESR may remain elevated. CRP level is not affected by anemia, while ESR becomes elevated in anemia. CRP in COVID-19. CRP correlates with severity of COVID-19 and is an independent predictor of mortality. Rate at which CRP level rises during first 7 days of hospitalization predicts disease progression and the need for early ICU transfer. Reduction in CRP within 72 hours of steroid administration serves as an early indicator of therapeutic response. Overall, serial CRP levels during hospital course provide more predictive power than a single maximum value. Advantages of CRP. It is a well-established biomarker for systemic inflammation. Measurement is rapid and relatively inexpensive. Half-life is 19 hours and it is comparable across different age groups and disease conditions. Circulating CRP concentration is determined only by its hepatic synthesis rate. Highly sensitive CRP. Highly sensitive CRP or HSCRP levels correlate positively in prospective studies with the likelihood for developing an acute coronary event. The strength of association is equivalent to and additive to LDL cholesterol elevations. The highly sensitive CRP test is most useful for people who have 10 to 20% chance of having a heart attack within the next 10 years. This test is not helpful for people with a higher or lower risk. Thank you.